Most people flush the toilet without looking, but that quick glance into the bowl could actually save your life. From hidden bleeding to liver problems, the shape, shade, and texture of your stool are daily health reports from your gut. By the end of this video, you'll know exactly what those warning signs are. Let me explain what's actually going on. Your digestive system takes between 24 to 72 hours to process the food you eat. What ends up in the toilet is 75% water and 25% solid waste, including dead bacteria. So what does a healthy stool look like? Doctors use the Bristol Stool Scale. The ideal stool is type 3 or type 4. It looks like a smooth or slightly cracked sausage. It should be soft, easy to pass, and stay intact when flushed. If your stool looks like hard, separate little lumps, type 1 or 2, that means it's been sitting in your large intestine for far too long. This indicates constipation, something we see very often at the clinic due to low-fiber diets. On the other hand, if you're passing mushy or completely watery stools, types 5 to 7, that's diarrhea. It means the waste moved through your colon too fast for the water to be absorbed. This frequently happens during food poisoning or stomach infections. Now, let's talk about color. A healthy stool is typically brown. If it is green, do not panic. It usually just means you've eaten a lot of green vegetables or the food moved through your digestive tract so quickly that the bile didn't have time to turn it brown. But here is a major warning sign. Black or bright red stool can indicate internal bleeding. While red might just be from eating beetroot, it could also mean bleeding in your lower digestive tract. Black, tarry stool often points to bleeding higher up, like in the stomach. What if your stool is pale or yellow? A pale or chalky stool means your body is lacking bile, which could point to a blockage in your gallbladder or liver issues. Yellow, greasy, foul-smelling stool usually means your body isn't absorbing fats properly. Chronic constipation isn't just uncomfortable. When you constantly strain to pass hard stools, it can lead to hemorrhoids, what we commonly call piles in Malaysia, or painful tears called anal fissures. Both can cause fresh, bright red blood when you wipe. A diet lacking in fiber can also cause high pressure in your lower intestine, creating tiny pouches in the muscular wall called diverticula. If these pouches get infected, it causes severe abdominal pain, fever, and nausea. We call this diverticulitis. If you constantly alternate between diarrhea and constipation, accompanied by bloating and cramping, you might have irritable bowel syndrome, or IBS. However, if you have persistent diarrhea with red stools, fever, and weight loss, it could be an inflammatory bowel disease, like Crohn's. Here is what I always tell my patients. Any new, sudden changes in your regular bowel habits are a red flag. Especially if you are over 50 years old, you will require a proper medical evaluation, which might include a stool blood test or a colonoscopy. Now that you understand the signs, what can you do? First, upgrade your diet. Get enough fiber from whole grains and legumes. Add more local fruits like papaya and drink at least 8 glasses of water a day to keep things moving softly. Second, support your gut bacteria by incorporating probiotics and prebiotics into your meals. If you suffer from IBS, your doctor might recommend a low FODMAP diet, which means avoiding certain sugars in dairy and vegetables that cause severe bloating and gas. Finally, keep an active lifestyle. Regular exercise actually helps move food through your digestive system, reducing constipation. Also, try to eat on a regular schedule, chew your food slowly, and cut down on excessive caffeine and smoking. If you have any concerns about your gut health, come down and talk to our doctors at Klinik Temasya. This video is for educational purposes only. Please consult your doctor or visit your nearest clinic for personalized medical advice. If you found this useful, leave your questions in the comments, share this video, and check out our other health guides.